I have heard a lot of scary things about birth control, about family planning. I've heard that it's going to make me add extra kg, and I don't want to add that. I don't need that excess weight. I've also heard that it's going to ruin my chances totally of getting pregnant, of having kids in the future. I've heard that it's going to make me sick. I've heard this from family, I've heard this from friends, I've also heard this from internet. But I decided to find out the truth by myself. And this is what I have found, and I have decided to come and share it with you today. Good day everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, and I make learning easy and accessible for all my viewers. On this particular video, we're going to be sharing with you 6 myths about family planning or your birth control. So the first one I have to share with you is that birth control makes you gain weight. Is that true? The answer to that question is not all birth control method cause weight gain. Yes, there are some birth control method that has been associated with weight gain, but not all. So if you are scared about adding weight and you want to have a family planning method, you can discuss with your doctor about it. They can provide options for you, such as the IUD and non-hormonal family planning method. Generally, research has shown that those family planning method that has estrogens and progesterone in them, they cause water retention, not necessarily the normal fat you get, it's water retention. So it's that water retention that shows as your weight gain. Am I making any sense now? But if you are not planning to add weight and you are scared about it, it is very important for you to discuss with your doctor about other options of family planning method. Before I go further when it comes to this myth, I want to let you know that there are different methods of family planning. So if one is not working for you, there is nothing bad in trying another method of family planning. And also, some people take this family planning method and there is no significant increase in weight gain. There are some research that has shown that there is no increase in weight gain with this family planning method. So if you just have this family planning method and you're experiencing weight gain, what I would advise is to also check other factors. Check if has there been a change in your routine? Has there been a change in your diet? Has there been a change in your gym routine? Just check around if there is something else that is causing that weight gain outside the family planning method. The second myth I would like to share with you is birth control ruins fertility. Birth control ruins your chances of getting pregnant. Is that true? The answer to that question is no. Most family planning methods do not cause permanent infertility. Your pills, your patches, your rings, immediately you stop using them, you return back to fertility. Immediately you stop using them, you return back to fertility. Most birth control, they cause a pause in your fertility. They don't stop or destroy your fertility. They cause a pause in it. They pause, okay, fertility pause first while I'm using it. Immediately you stop using them, you return back to fertility. But most times with depot, it might take up to a year for you to return back to fertility. Then the third myth I would like to share with you is pills protect you from sexually transmitted disease. That is a big lie. Pills does not protect you from sexually transmitted disease, STD. It only prevents pregnancy. It only what prevents pregnancy. The only type of birth control or family planning method that prevents STDs is the condom and the use of dental dam. So if you as an individual have multiple sex partner and you are always active when it comes to sex, it is advisable for you to use condoms or the dams. That is going to go a long way to prevent STDs. The other types of family planning method do not prevent STDs. And the fourth myth I would like to share with you is IUD is meant for women who already had kids. That is a misconception that has been circulating. IUD can be used by any woman trying to prevent pregnancy. Whether you've had kids before or you've never had kids, you've had sex before or you've never had sex, anyone can use IUD to prevent pregnancy. IUD is known as intrauterine device. And IUD is that same device that can help you prevent pregnancy after having sex within 5 days. So if you've had sex within 5 days and you are thinking, how do I prevent pregnancy, and postnatal 2 is not going to work, the next option for you is IUD. The fifth myth I would like to share with you is birth control affects your sex drive. It causes decreased libido. Does it really cause decreased libido? The answer to this question is that it causes decreased libido, but it all depends on the type of birth control and also your body. There are some people that takes this family planning method and do not notice any significant difference in their sex drive. To some, it reduces it, and to some, it even increases it because the anxiety of, oh, I don't want to get pregnant is gone. So it increases their libido. When it comes to the patches, the pills, those ones, they actually causes an increase in your testosterone level, which invariably can decrease your libido. But like I earlier said, it all depends on your body. To some, they take it doesn't have any impact, while to some, they take it and they have impact. So if you are worried about a decrease in your libido as a result of this hormonal method of family planning, you can have a discussion with your doctor, and they are going to provide you with an option of non-hormonal method of family planning. Then the sixth myth I have to share with you is the natural method of family planning does not work. Is that true? No, it's not true. The natural method of family planning, when done correctly, actually is effective. When you know your cycle, you know when you're ovulating, it actually goes a long way to help in preventive pregnancy. It is very effective when done correctly. Taking note of your basal body temperature, taking note of your cervical mucus, using the ovulation predictor kits, when done correctly, it can actually prevent pregnancy. There is a but when using the natural method. You have to be disciplined about it. It's kind of dicey in the sense that during your ovulation, when your body releases egg as a woman, that is the time your libido is usually high, because there's a release of this hormone that makes everything like wants to welcome the sperm, wants to take the sperm up for fertilization. So you have to be disciplined when using the natural method of family planning method. Natural method of family planning. Stop. All right. So these are the 6 myths I have to share with you in regards to family planning. But before I go, there's something I want to let you know. Your body, your choice. Okay, if a particular family planning method is not working for you, you don't have to suffer it. You don't have to keep quiet. It's very important for you to go to the doctor, tell them how you feel about this particular family planning method. It should be taken out if possible, and other options be explored. Okay, there is no one type of family plan. There are different types that you can actually pick for. If a particular one is not working for you, go for another. If another is not working for you, try another and see how it goes. It is very important for you to also know that all these family planning methods I've just listed, they have their own side effects. They have their own risk factors. It's also very important for you to talk to your doctor to let you know the do's and don'ts of each family planning method, and you know if it's beneficial for you or not. Remember, your body, your choice. It's not my body, your choice. My body, my choice. Your body, your choice. If you've ever experienced any awful experience with family planning, please and please, I would like you to drop it on the comment section. I would like to know your experience with family planning. Was it great? Was it wonderful? Was it awful? I would like to know your own personal experience with family planning. Feel free to drop it in the comment section so that others can also learn and be motivated to share their experience. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video. And remember, Nurse Mercy Mary loves you.